That's the tumor covering all that space?
Yep. So it's 40 by 32 millimeters. Okay.
So is that, I think they told me 4 centimeters at first.
Yeah, 40 millimeters is 4 centimeters. Come on, you're younger than me. You had metrics.
Yeah, you know what?
The other thing is, see these black areas, those are spinal fluid chambers in your brain, and they're supposed to be nice and symmetric, like butterfly wings. And you can see how the one on the right side is so compressed, pushing over. I'll show you this other view here. So this is a view that shows swelling in the brain. You can see the tumor now is not as evident, but look at all this white tissue, which is all the swelling in the brain.
That's swelling.
Yes.
The tumor, is that tumor expanding or that's just swelling on my brain?
It's swelling in your brain, which is how the brain reacts to a tumor like this. Okay? So it's swelling like if I shot you with a rubber band and you had a welt. You can't put a needle in or squeeze the water out. It's in the tissue itself.
Okay.
And that's what this is. So we have you on high doses of steroid medicine, dexamethasone, to reduce that swelling, which should help a lot with headaches.
Okay.
That'll help far better than any Tylenol or Percocet.
I tried Tylenol once, twice. It didn't really do too much.
No, we got to get this swelling down because you can see in relationship to the size of the tumor, the swelling is what, 3-4 times. And that's what's putting all the pressure on your brain, and that's why things are pushed way over here. What the radiologist did here was they drew a line right down the middle of your brain and then measured the shift, and it's 16 millimeters of shift.
Okay.
Which is quite a bit. Okay. So this is most likely metastasis from or spread from the colon cancer.
That's what I was trying to get to the nitty gritty. Was it brain cancer or was it metastatic?
Yes, it's probably a metastasis because that view with the dye, this one, when you look at it, the tumor's pretty round and it's got the black in the middle, which is especially colon cancer. Colon cancer comes from the glands, and so glands secrete fluid and mucin and stuff. So colon cancer, breast cancer, the cancers that come from glandular tissue tend to have cysts within them. So that all fits. Okay? So the recommendation is that we take this thing out. You know,
that's what I'm hearing. I'm hearing, and it's kind of not smart to do a biopsy in this case.
Well, I mean, the biopsy will tell us what it is, but then you saw all that pressure on the brain.
Swelling and pressure, that's still going to be, yeah.
Exactly. So it's not going to buy you anything. And with metastatic tumors, we can treat them with radiation. There's a special technique, but typically only tumors about 3 centimeters or smaller. Yours is 4 centimeters. So it's too big for radiation. Plus, radiation for the short term.
Is that for me?
Yep.
What is it?
Salmon, rice.
Okay, thank you. Appreciate that.
Radiation will make the swelling worse.
Right, okay.
So that's why the best thing is to take it out.
Okay.
To get the pressure off of your skin. Got a busy room here. So we're going to do that tomorrow with your permission. I would be the one doing it.
Okay, so you're the general surgeon?
I'm the neurosurgeon.
I saw about 3 guys that said they were the surgeon.
Yeah, they're my residents.
Resident, okay.
Yeah. No, I'm the guy in charge.
Okay. And what's your name again?
Here's my card. Judy. Just like the girl's name.
Like Judge Judy?
Yep.
All right.
So
the operation, we'll take you to the operating room, put you to sleep.
Tell me? What's it?
Get over here.
Hi. I'm gonna see how right you are.
Takes about 3 or 4 hours.
Okay.
Then we'll you take it to the ICU where we'll watch you overnight. We're gonna need to shave some hair on the right side.
Man, just give me a symmetric jump. Just have me, cut it all if you got to do it. Whatever it takes to do it right.
Well, your head's gonna be turned, so we can only get to the right side.
Okay, so you're just
We
going to
can trim
need
it up
whole
later.
right side?
No, just probably where we're gonna make the incision. Typically, we only shave about that much. And then you have a big muscle.
Then leave hair around it?
Yeah. And then when it grows back, it'll blend in.
Blend
It's
in?
not that long.
Right.
It won't take long.
Hey, you asked me
Yeah,
to hire.
make it-
So how does hair growth of scarring? Is that a messy type? Is it like ingrown hairs and a messy type thing with
you
that?
can
Or?
get some ingrown hairs, yes. But typically, it's not a big deal.
Bring this closer to you.
Okay? So then the incision's on the side of your head so we can get to this. You have a big muscle on the side of your head that attaches to the side of your skull, comes down in front of your ear and closes your jaw. We have to take that muscle down. We'll put it back together, but that's going to be tender when you talk or chew for a few weeks.
So it's not all skull. You're cutting some muscle.
Well, to get to it. If
Okay.
it were up here, there's no muscle here. We just have
That's
to go
just
through the
skull,
scalp.
right?
Let me know if you need anything.
So it's more like in this area
Yes.
by the temple
Yeah, on the other side, but yeah.
on the other side. So it's a little skull, but mostly muscle.
Yeah.
Okay.
We
Yeah.
put it all back together.
Right.
We put the bone back.
Right. Okay.
The risks are anytime you cut the skin, you can have bleeding, infection, or pain, and the pain's mainly from that muscle. There's risks of touching the brain causing a seizure or a stroke. Your eyes are in the front of your head, but where you see is actually in the back of your head here in the occipital lobes. And the tumor, where this tumor is close to where those optic fibers cross over to go back. So if they're damaged, it would affect your peripheral vision on the left.
Oh gosh.
I think your tumor's pretty far forward that we shouldn't get into that, but that's a possibility. And then there's always the risk that we can't get all of the tumor out because it is involving an important blood vessel or important part of your brain. But from what I see on the scan, we should be able to get it all out. Okay? So typically, once this tumor's out, the headache from the surgery, most patients say it's nothing compared to the headache they were having before, especially with all that amount of swelling that we had. And I believe, did they tell you when? I think you're scheduled for first thing in the morning.
Yeah, I think somebody mentioned 7:30 or something like that. I'm not sure who it was.
Here, I'm pulling up the OR schedule. All right, there you are. 7:30 tomorrow morning, room 9. No sleeping in. So we'll be taking you down around 7 or so.
And then I'll be able to see him after.
Yes. You can see him before if you want. You just have to get here by about 6:30.
Yeah, get here early.
Are you?
It's my wife.
You what?
Yeah.
Your wife? All right. So when you come in downstairs, they're going to stop you at the information desk and just say, my husband's having surgery, and they'll let you write it.
Okay.
It's not a problem.
Okay.
And then there's a waiting room for people having surgery on the third floor. So if you hang out there, then we can track you down. The circulating nurse can give you updates and things.
Okay.
And then I'll talk to you when we're done. Okay?
Awesome.
All right.
Awesome.
You recording this or just?
Yeah, I'm recording and taking pictures and seeing my brain looks like.
There's a brain in there.
Yeah, it's the first time for everything.